Low-intensity laser therapy with Skorpion dental Optima. The movie is made under methodological guidance of main assistant Tsong Kuzunov, Faculty of Dentistry, Sofia. Laser radiation is a stimulated electromagnetic radiation of light spectrum. The most frequently used rays for low-intensity laser therapy are these with waves length from 630 to 660 nanometers, apart from the visible light spectrum. Laser radiation's parameters directly related to the efficiency of the biological effects are as follows. Waves length that determines laser radiation spectrum. The depth of penetration and the character of interaction between quantum energy and the biological tissue depends on the wavelength. Long-lasting clinical tests confirmed highest biological efficiency of the light of the red visible spectrum. Power of radiation determines the quantity energy implemented in zone for biologic influence per time unit. Power density is a secondary power parameter. It determines energy's distribution per unit area and the character of biologic efficiency. Time of therapy determines stimulation's continuous and hence the whole quantity of energy taken in the field of therapy. The frequency of following impulses has an additional effect on the influence of radiation towards increasing or decreasing anti-inflammatory, antispastic, anesthetic and urotrophical effects. Low-intensity laser radiation for biological processes stimulation in tissues takes place in the stomatology for over 25 years. It is already apart from the confirmed schemes of treatment due to advantages this type of therapy provides. Proper combination of classic treatment methods and laser therapy accelerates control under inflammatory processes, tissue regeneration, improves effect of treatment in more complicated and risky cases, and provides painless treatment. The optimal biological effects of laser therapy are based on active stimulation of regenerative processes in the tissues, highly expressed anti-inflammable effect, expressed local anesthetic effect. The laser therapy is applied to the treatment of the following common dental illnesses. Pulpitis, applied to cases of inflamed dental pulp for inflammatory process control by methods of biological treatment. The laser energy implemented into the pulp normalizes the confused blood circulation, suppresses exudation and pain, and stimulates tissue's regeneration. This treatment can be combined with medicamental therapy, which affects etiological factor of inflammation. After vital extirpation, the laser treatment suppresses the traumatic inflammation and pain in the apical area, and after mortal extirpation, arsenic apical and marginal periodontitis. Periodontitis. Anti-inflammable and anesthetic effect of laser therapy is applied to cases of acute, chronic and exacerbical periodontitis. Pain decreases after second procedure and the acute phase of inflammatory process shortens with 2-3 days. Considerable acceleration of regenerative processes is observed. Method is successfully combined with medicamental and ionophoretical treatment. Gingivitis. Therapy suppresses inflammatory processes and stimulates metabolism and regeneration. Therapy is well combined with ionophoretical introduction of capillary strengthened vitamins C, CP, galoscorbin, aloe, and so on. Periodontitis. Applied to cases of periodontitis, the low-intensity laser therapy supports the elimination of disturbances in periodontal blood circulation and metabolism, hypoxia, oppresses the pain and inflammation. This therapy is applied together with a complex of therapeutic, surgical and orthopedic treatment. Optimized methods for the separate illnesses developed and approved from the leading experts in the faculties of stomatology are written in the instructions. These methods are recommended as a good appliance for specialists who will apply or are applying these methods. The assumed clinical experience gives an opportunity of adapting the methods to the specifics of each concrete case. During the last years, the laser therapy becomes an integral part of the treatment methods in cases of stomatitis, trauma and fractures, before operative preparation and after operative treatment, arthritis and arthrosis of the temporomandibular joint, pathology of the salivatory glands. In each method, the indications and contradictions of laser therapy are shown together with statistically optimal values of the necessary density of power laser radiation applied to one field, the number of fields for therapy, the number of the procedures, and so on. For facilitation of the dentist, in each method are shown the appropriate devices for translation of the radiation. The optimal values of the following parameters are shown as a table: power, time, frequency. With these values, the results are closer to the optimal ones. The following devices are used in the Skорпион complex: light guide for frontal therapy, light guide for distal therapy, focusing light guide, hard shaft for lingual therapy, flexible light guide, system for intraoral therapy, laser scanner, system for magnetic laser therapy. The optical tips are sterilized with disinfecting solutions, formalin gases, gas sterilization. In this film, it is shown a laser therapy after cystectomy of cister radicularis of the 16th tooth. The section begins from the 14th and ends in the 17th tooth. Laser therapy is applied with medicamental treatment. This therapy fastens the formation of granulated tissue, its fibrosis and ossification. Laser therapy begins on the second day after the removing of the bandage on the 14th tooth, vestibular and lingual. The therapy is applied as follows. The devices are prepared. A sterilized tip is put in the emanator. Protective glasses are placed on the face of the patient. The laser emanator is placed in the patient's hand. The frontal part of the tip is slightly laid in the field of the gingiva, and the procedure is started. In cases of buccal treatment, beveled optical tip is used. The most appropriate light guiding shaft in cases of lingual treatment is the hard one. A few more procedures should be made to the patient before the ending of therapy. Now you can see laser therapy applied to a case of initial catarrh or gingivitis. The laser therapy is applied after removing the local irritations, odontolith, unqualitative obturations and others. At the same time, medical treatment is applied. The effect of the therapy is decreasing permeability of the blood vessels, decreasing of exudation, edema, and highly expressed analgesia in the irradiated areas. The device is programmed for regime according to the recommended tables, in this case for gingivitis. A sterilized optical tip is put. In this case, the frontal one is recommended. The radiator should be put in the patient's hand, and with the help of the dentist, it should touch the first zone of the therapy. In this way, all the areas which the dentist has estimated for necessary should be touched consecutively. A method with scanning irradiation with laser scanner can be applied to cases of generalized gingivitis. The patient suffers from arthritis of temporomandibular joint. The purpose of the therapy is the decreasing of pain symptoms, improvement of blood circulation and metabolism, suppression of the joint irritation. An accessory magnetic field is applied to decrease the adaptation of the tissues to the laser radiation. The special device for magnetic laser therapy is used.